So students, we will be discussing about the back and the scapular region today. So this is the skin. When we reflect it along with the superficial fascia, we can appreciate certain muscles which are bounded up by the deep fascia. So first we will be having the first layer of muscles, the trapezius muscle, which is so named because it is trapezium in shape. Now this is trapezium in shape. If we talk about its attachments, it comes from the external occipital protuberance, the superior nuchal line, then the ligamentum nuchae, which extends from all the cervical spines except the C7 spine and all the thoracic spines. If we talk about its insertion, so now let's see it on the skeleton first. So let's see the attachments first. So this is the external occipital protuberance. Then you are having the superior nuchal line. Then the ligamentum nuchae will be extending towards the first 6 spines, that is first, second, third, fourth, fifth and sixth. Then we are having the attachment of the trapezius from all these transverse process, the spinous process of the thoracic vertebrae and the 7 cervical vertebrae. They will be sending out 3 fibers. The upper fibers will be coming like this, the middle fibers will be like this, and the lower fibers will be like this. The upper fibers will be getting attached on the clavicle, on the posterior surface, on the lateral 1/3 of the clavicle. Then rest of the fibers will be having its attachment over the superior lip of the spine of the scapula. So this is how the trapezius is getting attached. Deltoid muscle. Now deltoid muscle is having 3 fibers. As in trapezius, there were upper fibers, the middle fibers and the lower fibers. The deltoid will be having the anterior fibers, the middle fibers and the posterior fibers. Let's see their attachment first on the skin. Sure. So the deltoid will be gaining its attachment from the anterior surface of the lateral 1/3 of the clavicle. This will be the attachment for the anterior fibers. Then we will be having attachment of the middle fibers. Now middle fibers are multipinnate and getting attached over the lateral lip of the acromion process. And then finally we will be having the attachment of the posterior fibers, which will be getting inserted on the lower lip of the spine of the scapula. These will be getting inserted, all these, the anterior fibers, the middle fibers and the posterior fibers will be getting inserted over the deltoid tuberosity of the humerus. Next we are seeing that is the latissimus dorsi. Now this is having a muscle which is having a very extensive origin and a minute insertion. So extensive origin comes right from the iliac crest, then the lower spines along with the lower ribs, the thoracolumbar fascia and also the inferior angle of the scapula, and all these will be getting attached towards the and will be forming the floor of the intertubercular sulcus. Seeing it on the skeleton, you are having this is the iliac crest. So on the posterior surface of the iliac crest, on the medial 1/3, it will be getting its attachment. Then it will be having its attachment from the lumbar processes of the spinous processes of the lumbar vertebrae. Then it will be having also attachment with the lower 4 ribs, the thoracolumbar fascia covering it, the inferior angle of scapula, and all these muscles will be following an oblique course and will be finally getting inserted into the floor of the bicipital groove or the intertubercular sulcus. First layer or the superficial layer of the muscles in the back and scapular region. Now we are removing the trapezius muscle and the deltoid muscle. What we see is the rhomboid muscles. This is the rhomboid muscle and it is a quite big muscle, that is the rhomboid major muscle. This one
being the levator scapulae muscle, and this one is the rhomboid minor muscle.
The rhomboid major muscle,
the levator scapulae muscle, and the rhomboid minor muscle.
Attachments of the levator scapulae, it will be having its attachment from the transverse process of the first and the second cervical vertebrae and the third and the fourth cervical vertebrae. So all these fibers will be getting coming from here and will be getting attached on the medial border on the posterior surface towards the superior angle of the scapula. So over here the levator scapulae will be getting attached. Then down below there will be the rhomboid minor, which will be coming
From the lower part of the ligamentum nuchae along with the spines of C7 and T1 getting attached to the triangular area at the root of the spine of the scapula. Then
we having the rhomboid major, which will be getting attached over the medial border of the scapula on the dorsal aspect, and they will be getting originated from the lower thoracic spines. So after the rhomboids, let's look about the supraspinatus, infraspinatus, the teres minor muscle. Now the supraspinatus muscle is situated above the spine of the scapula in the supraspinous fossa. The infraspinatus muscle is located in the infraspinous fossa below the spine of the scapula, and then you are having the teres minor muscle. Let's see their attachments on the bone. So supraspinatus muscle, this will be coming originating from the supraspinous fossa and will be getting inserted over the upper impression of the greater tubercle. The infraspinatus fossa will be originating from the 2/3 of the infraspinous fossa and will be getting inserted towards the middle impression. And then you will be having the teres minor muscle, which will be arising on the dorsal aspect of the lateral border of the scapula and will be getting inserted towards the lower impression. So supraspinatus will be over here, then you are having the infraspinatus, and then finally the teres minor. Along with this, there is another muscle that is known as subscapularis muscle, which is getting attached on the costal surface of the scapula. This fossa is subscapularis fossa, and the fibers which will be coming through it will be getting attached to the lesser tubercle. So altogether, these four muscles, the subscapularis muscle, the supraspinatus muscle, the infraspinatus muscle, and the teres minor, all these four muscles are known as rotator cuff muscles because they are forming a cuff around the shoulder joint. Next we are having the teres major muscle. Now this teres major will be arising from the lower third on the lateral border of the scapula on the dorsal aspect and will be getting inserted over the medial lip of the intertubercular sulcus. So let's see it on the bone. So the teres major will be taking its origin on the dorsal surface of the lateral border of the scapula and will be having an oblique course and will be getting inserted on the medial lip of the intertubercular sulcus.